Before this woman's doctor ordered a single blood test, before any scan, before any needle touched her arm, he asked her to do one simple thing: stick out your tongue. She thought it was routine, a formality, the kind of thing doctors do out of habit, like checking your reflexes with a little rubber hammer. It wasn't routine. He was reading her. Within seconds, he noticed a deep red patch across the tip of her tongue. Unusually smooth, almost shiny, missing the tiny bumps that normally cover a healthy tongue surface. He asked one follow-up question about her diet. 20 minutes later, a blood test confirmed what he already suspected from that 10-second look. A vitamin B12 deficiency, severe enough to eventually cause permanent nerve damage if left untreated. She had no idea her tongue could do that. Most people don't. Your tongue is one of the most information-dense surfaces on your entire body. It's covered in thousands of taste buds packed with blood vessels sitting incredibly close to the surface, and it renews its own cells faster than almost any other tissue you have. That combination makes it one of the fastest, clearest windows into what's happening inside you. And doctors have been using it as a diagnostic tool for literally thousands of years, long before modern blood testing ever existed. Today, we're going through every major tongue sign your body can show you: the colors, the coatings, the cracks, the textures, what each one actually means, and exactly where the line sits between something completely normal and something worth a real conversation with a doctor. Stay until the end, because the last sign on this list is one that dentists are trained to catch before almost anyone else notices it, and it's more common than you'd think. Let's get into it. A second opening story before we more real-world style example, because one story alone can feel like coincidence. And this topic deserves more than that. A father brought his young son into a pediatrician's office with a high fever that had lasted 5 days, along with red, cracked lips and swollen hands. The moment the pediatrician looked at the boy's tongue and saw that unmistakable strawberry texture, deep red with prominent, swollen bumps, she immediately moved the case from probably a viral infection that will pass to possible Kawasaki disease requiring same-day cardiology evaluation. Kawasaki disease, if left untreated, carries a real risk of causing damage to the coronary arteries in children, and catching it within the first 10 days of symptoms dramatically improves outcomes. That single visual cue on the tongue was the detail that changed the entire trajectory of that child's care that day. Two completely different patients, two completely different underlying conditions, a vitamin deficiency in one case and a rare inflammatory illness in the other. And in both cases, the tongue was the very first thing that pointed a trained eye in the right direction, faster than any other part of the physical exam could have. Why this works: your tongue surface cells get replaced roughly every 10 to 14 days, compared to a fingernail which takes 3 to 6 months. That means your tongue reflects recent changes almost in real time, not slow building history. If something shifted in your body in the last week or two, your tongue may already be showing it. Sign 1. White coating, thin white film, especially in the morning, is completely normal. Dead cells, food debris, and bacteria building up overnight while saliva slows down. It clears after eating or brushing. Thick, patchy coating that looks like cottage cheese and doesn't wipe away easily can be oral thrush, a fungal overgrowth more common with weakened immunity. Inhaled steroid use, antibiotics, or poorly controlled diabetes. Peeled white patches on the sides that won't scrape off at all, lasting more than 2 weeks, is a different pattern called leukoplakia, linked to tobacco and heavy alcohol use. Most cases are benign, but a small percentage can be precancerous, so it deserves an actual evaluation. Sign 2. Strawberry red tongue, deep red with swollen, prominent bumps. In adults, this is most associated with B12 or folate deficiency, common in vegans without supplementation, and in older adults with reduced absorption. Left untreated, B12 deficiency can eventually cause nerve damage. In children with a fever, a strawberry tongue is a classic sign of Kawasaki disease or scarlet fever, both requiring prompt evaluation. This combination should mean a same-day doctor's visit, not a wait-and-see approach. Sign 3. Purple or blue. Tongue mechanism as bluish fingernails. It reflects blood oxygen levels. Well-oxygenated blood is bright red, low oxygen turns it darker and bluer, and the tongue's dense surface vessels show this clearly. Cold exposure or dark pigmented foods can cause a temporary version. Check if it fades within an hour. A persistent blue-purple tongue, especially with breathlessness, can point to chronic lung or heart conditions and deserves prompt attention. Seigen of cracks and fissure, small grooves across the surface. Sometimes a deep central crack, sometimes a branching pattern. This is called fissured tongue. Extremely common. 10s to worsen gradually with age, and in the vast majority of cases, is a harmless genetic trait, requiring nothing beyond good hygiene in the grooves. Sudden fissuring in adulthood with pain is the pattern worth mentioning to a dentist. SIGN 5. Geographic tongue smooth. Red patches with white borders that genuinely look like a map, and the pattern actually migrates over days or weeks. This happens because papillae temporarily lose their outer layer in specific spots, then heal and shift elsewhere. Despite how dramatic it looks, it's benign in the overwhelming majority of cases, sometimes linked to genetics or mild associations with psoriasis or allergic conditions. Worth a first-time check with a dentist just for peace of mind. SIGN 6. Black, hairy looking, thungwid, most alarming to look at, and also one of the least serious. Papillae overgrow and elongate, trapping bacteria, food, and pigments from coffee, tea, or tobacco, creating a dark, fuzzy texture. Common triggers: smoking, heavy coffee or tea, poor hygiene, dry mouth, certain antibiotics. Almost always resolves within weeks with better hygiene and reduced triggers. SIGN 7. Swollen, scalloped, e.g. wavy. Tooth imprint pattern along the sides can simply be a naturally larger tongue or a habitual pressing habit. More meaningfully, it's been linked to hypothyroidism, where reduced thyroid hormone causes fluid retention in body tissues, including the tongue, usually alongside fatigue, weight gain, and cold intolerance. SIGN 8. Smooth, glossy tongue gloss of the normal slightly bumpy texture, leaving it shiny and bald. Called atrophic glossitis, most commonly tied to B12, folate, riboflavin, or iron deficiency. Interestingly, the same deficiency that cause a strawberry red tongue in one person can cause this smoother look in another. Also associated with celiac disease and Sjogren's syndrome. Often comes with soreness or sensitivity to spicy or acidic food. SIGN 9. Yellow tongui, usually simple, dehydration, smoking, certain foods, or a temporary bacterial shift after antibiotics. A genuinely concern involves actual jaundice from liver dysfunction, but that almost always shows up in the eyes and skin too, not the tongue alone. SIGN 10. Lumps or sores that won't heal, the most important sign on this list. Ordinary canker sores heal within 1 to 2 weeks on their own. A lump, thickened patch, or sore, especially on the sides or underneath the tongue, that persists beyond 2 to 3 weeks, particularly if it's painless at first, is the pattern that needs a proper look. Risk factors include tobacco, heavy alcohol, and HPV, which has become an increasingly recognized cause of oral cancers, even in people with no traditional risk factors at all. This is exactly what dentists check carefully during routine visits, and it's often caught there before anywhere else. The 2 to 3 week rule is the single most important takeaway from this entire video. QAche, my THS tongue scraping, is good hygiene, not a cure for anything underlying. A perfectly bare tongue isn't automatically healthier. A thin coating is normal. Tongue color alone never diagnoses a disease definitively. It's a prompt to check further, not a standalone answer. Bringing IT together. Color changes generally reflect your blood and circulation. Texture changes reflect how the papillae are responding to hygiene, hydration, or nutrition. Shape changes point toward mechanical habits or a systemic condition like hypothyroidism. The simplest checklist: how long has it been there? Is it new or lifelong? Does it come with other symptoms? And for anything resembling a sore, has it actually healed within 2 to 3 weeks? Every single sign covered today exists on a surface you already look at, or at least glance past multiple times a day. Every time you eat, brush your teeth, or speak, you don't need a specialist appointment to start noticing. You don't need any equipment beyond a mirror you already own, and 30 seconds you can genuinely spare. Your tongue has been quietly recording information about your internal health this entire time, using a language that ancient physicians across entirely separate civilizations independently learned to read thousands of years before modern medicine existed, and that we've now confirmed and explained with a far more precise understanding of exactly why it works. That woman from the beginning of this video, the strawberry red tongue, the B-Dud deficiency caught before it could progress to permanent nerve damage. That young boy with the fever whose tongue shifted his entire care plan within minutes. Neither of their bodies was hiding anything. Both were communicating clearly, and someone trained to look simply knew how to listen. The next time you're brushing your teeth, take those 5 extra seconds. Actually look, not to self-diagnose, not to spiral into worry, just to notice. Because sometimes the clearest signal your body can send you isn't buried inside a scan or a lab report. It's sitting right there in your own mouth every single day, waiting for you to actually pay attention. If this video taught you something new, hit subscribe. We are covering the rest of your body Next, one hidden signal at a time. Drop a comment letting us know which sign surprised you the most. I'll see you in the next one.